Good morning. Today's Medical Minute is brought to you by an article taken from WebMD titled Lyme Disease. What to Know This Season, published May 20th, 2016. The tick responsible for Lyme disease is showing up in new areas in the United States, a worrisome trend. Although the majority of cases are still reported in the Northeast, the black-leg tick, also known as the deer or bear tick, has been found as far south as Florida and as far north as Canada, as indicated by data from the CDC. And while experts say it's impossible to forecast how bad this tick season from about spring to winter will be, cases have been trending upward, doubling nationwide between 1995 and 2014. CDC epidemiologist Dr. Paul Mead says there's been a steady, gradual increase in cases of the disease and the areas where the ticks live. It's like a bomb going off. It's spreading in all directions, says Dr. Mead, Chief of Epidemiology and Surveillance Activity, Bacterial Disease Branch. For most people, the disease causes flu-like symptoms. About 80% of people who get it fully recover by taking antibiotics, says Dr. John Aycott of the Johns Hopkins Lyme Disease Clinical Research Center. Well, what's driving up Lyme numbers? A worldwide warming trend has made more northern areas like Canada, Maine, and Minnesota hospitable to ticks, but the number of deer which carry the ticks probably plays a bigger role, says Dr. Mead. Land use, forestry growth, and how many people develop homes in areas with large deer populations are among the factors driving this long-term trend, he says. Public health officials report between 30,000 and 36,000 cases of the disease a year, although experts believe the number is closer to 300,000. The ticks are most active in May, June, and early July, Mead says. How do you know if you've been bitten? Given that the ticks are the size of a poppy seed, you've got to have pretty good eyes. The CDC recommends that if you've been walking in the woods in tall grass or working in the garden, check your skin afterward, ideally in the shower or bath. That way you've removed your clothes, which may carry ticks also. What do you do if there's a tick under your skin? Remove it with a pair of fine-tipped tweezers as soon as possible, pulling upward with steady pressure. If parts of the tick remain in the skin, also try to remove them with the tweezers. After it's out, clean the bite area with rubbing alcohol or soap and water. Dr. Mead says you're not likely to get infected if you remove the tick within 36 to 48 hours. Some people have an allergic reaction to ticks, so they'll notice a bite right away. How do you dispose of a tick? Place it in soapy water or alcohol, stick it to a piece of tape, or flush it down the toilet. What are the early symptoms of Lyme disease infection? They mimic the flu: fever, chills, headache, fatigue, and muscle and joint aches. The appearance of a bull's-eye rash, the kind with a spot in the middle and a ring around it, is a clearer warning sign. It shows up in almost all people infected with Lyme and begins at the site of the tick bite after 3 to 30 days. But on average appears in about 7 days and gradually expands. It isn't itchy or painful. The rash is a pretty good indication that you may have been bitten. At this stage of the illness, treatment with antibiotics will likely be successful, Dr. Alcott says. How is it treated? With the antibiotics, amoxicillin and tetracycline, usually for 10 to 21 days. Other antibiotics that may be used include sulfoxamine or doxycycline. If you're treated early in the infection stage, a full recovery is likely. What's the best way to prevent a tick bite? Ticks can't fly or jump, but instead live in shrubs and bushes and grab onto someone when they pass by. To avoid getting bitten, wear pants and socks in the woods, areas with lots of trees, and while handling fallen leaves. Wear a tick repellent on your skin and clothing that has DEET, lemon oil, or eucalyptus. For even more protection, use the chemical permethrin on clothing and camping gear. Shower within 2 hours after coming inside if possible. It lets you look at your skin and wash ticks out of your hair. Also, put your clothing and any exposed gear into a hot dryer to kill whatever pest might remain. What if my dog is bitten by a tick? It's pretty likely your furry pal has been bitten by a black-leg tick, especially if you live in the Northeast. In fact, dogs are a barometer of where ticks live, Mead says. The fact that dogs are good at picking up ticks means that where humans are getting Lyme, dogs are getting it very often. Where they aren't infected a lot is a good indicator where Lyme is not, he says. And they can get sick. About 10% of dogs with Lyme disease will become ill. Common symptoms are laminese, a fever, lethargy, and enlarged lymph nodes. Dogs also receive antibiotics for treatment. What if my dog brings the ticks in the home? Practice prevention habits and use a tick control product on your pet. Thank you and have a blessed day.